Action.
Okay, we're going to begin with Williams flexion exercises. So have the patient bring both knees to the chest, grab them, hold them. Okay, we're going to hold for a minimum of 10 seconds, working our way up to 1 minute. And we're going to do 3 sets and working our way up to 5 sets. So if the patient needed more, he could tuck his chin in to release those paraspinals as well. The second exercise is going to be a pelvic tilt. So the iliums are going to go posterior, pelvis is going to go anterior. So I want you to rock your pelvis forward and lower, release. And same thing, we're going to start, we're going to hold 10 seconds in that position, 15, 30, 45, up to 1 minute, and 3 sets, working your way up to 5 sets. Can I have you go face down? On your knees, I'm sorry, on your knees. Okay, patient's going to step 1 foot forward. Okay, and stretching the hip flexors, I'm going to have him drop that pelvis forward, keeping the knee behind the toe. And again, for the same 10 seconds, 15, 30, 45, up to 1 minute, 3 sets, switching to release the hip flexors. And in strengthening these muscles, the paraspinals, multifidi, I'm going to have the patient go on all 4 hands and knees. Okay, and he's going to draw his belly button into his spine, and he's going to hold that position, keeping the head in neutral so that this doesn't arch at all. Now have him lift, first starting with the right arm, straight out in front, without rocking up the pelvis or the shoulders. And then we're going to switch to the other arm. Progression, we're going to go to the leg. Okay, without rocking forward and down. And switch. And again, same thing, we're going to hold these for 10 seconds, working our way up to 1 minute. 3 sets, working our way up to 5 sets. And to strengthen the glutes, go ahead and stand up. Attaching this to the patient's thigh. He's going to use a chair for stabilization, needed. He's going to do some hip extension exercises. He's going to do 3 sets of 6 at a slow pace, keeping the legs straight without leaning the torso forward, just isolating to the hip. We're going to increase the tension 3 times, and then we're going to increase the amount of repetitions, so then he would go up to 3 sets of 10 at a slow pace, 3 sets of 10 at a fast pace for the progression. All of these exercises, the Williams flexion, the core stabilization came from the PT class, and the TheraBand exercises. And then we would reassess, and using the KIMS test, post exercises, there should be a decrease in the pain upon the movement because the muscles are stronger holding the vertebra in place. And in the forward lumbar flexion, the vertebra will be able to move in a normal pattern so that they won't, block and buckle that way. So you should see improvement in those. Thank you.